Prior to completing my head-to-toe assessment today, I would like to note that for privacy reasons, my patient will be leaving on his clothing items. I would note that in a clinical setting or a healthcare setting, I would have my patient either lower their gown or remove clothing items in order to auscultate, inspect, and assess my patient appropriately. I'm now going to have my patient walk into the room. Prior to walking into the room, I would ensure that I perform hand hygiene as well as note any isolation precautions for my patient in order to don the appropriate PPE prior to completing my assessment. Good morning, my name is Caitlin. I'm going to be your nurse today. Can you verify your name and date of birth for me?
Hey, it's Jamie Johnson. It's 05/08/1999.
Perfect. Upon walking into the room, I did note for my patient's gait to be steady, his posture erect, as well as having a calm and cooperative effect. My patient is noted to be dressed appropriately for the weather, as well as his speech is clear and not slurred. Okay, Mr. Johnson. So today I'm just going to be doing a head-to-toe assessment. While I'm doing the assessment, I'm going to explain what I'm doing and why I'm doing it, as well as things that we are looking out for. I would also like to note that my patient's vitals have been assessed prior to this assessment, so we will not be doing that today. His vitals were noted in his chart to be within normal limits, which is a good thing. So, Mr. Johnson, are there any allergies that we should be concerned with?
No, ma'am.
Okay, are you in any pain at the moment?
No, ma'am.
Okay. So first, Mr. Johnson, I'm just going to go ahead and I'm going to ask you a couple questions, okay?
All right.
What's your name?
Jamie Johnson.
Okay. And do you know what month and year it is?
September of 2022.
Okay. And do you know who the president is?
It's Biden.
And where are you right now?
Hospital.
Okay. I've noted my patient to be alert and alerted ×4. All right, Mr. Johnson. So now I'm going to go ahead and start assessing your head. All that's going to include is I'm going to assess your head in total, as well as your eyes, ears, nose, throat, and your mouth. Prior to completing this assessment, I'm going to note that my patient does use corrective lenses and no use of an assistive hearing device was noted. And I'm going to also have my patient remove his corrective lenses for this portion of the exam. So Mr. Johnson, if you can go ahead and remove your lenses for me. Okay. So first what I'm going to do is I'm just going to inspect my patient. So upon inspection, I'm going to note that my patient's skin is pink and appropriate for ethnicity. I have not noted any bruises, lesions, scars, or abnormal findings on my patient's skin at this time, and his hair is noted to be dispersed appropriately throughout the head. Mr. Johnson, I'm just going to start by palpating your ears. Is it okay if I touch you?
Yes, ma'am.
Okay. Tell me if you feel any pain or tenderness.
No.
Okay. Now I'm going to go ahead and I'm going to look into your ears. Can you turn your head the other way for me, please? Perfect. Okay. Upon doing this portion of the exam, I have noted that my patient's ears are not demonstrating any redness or tenderness at this time. I've also noted no finding of any abnormal fluids or drainage throughout my patient's ears. Mr. Johnson, next I'm just going to do a hearing test, which is just going to be a whisper test. All I'm going to have you do is I'm going to have you turn your head and look at that wall for me. I'm going to have you also plug your opposite ear, and we're just going to assess your hearing, okay? I'm going to whisper 2 words, and I want you to repeat it back to me.
Cat, dog.
Very good. And now I'm going to walk to the opposite side of my patient to be able to perform it on the other ear. Go ahead and do the same thing.
Flower and fish.
Very good. All right. I've noted my patient's hearing to be intact. All right, Mr. Johnson. Next, I'm just going to assess your eyes, your nose, and your mouth at the same time, okay?
All right.
So first, I'm just going to look at your eyes. Okay? And now I would note that if I was assessing my patient's reaction to light, I would dim the lights in order to do this correctly. So I'm just going to go ahead and shine my light. I want you to focus on that wall behind me, and I'm going to shine the light a couple times with both eyes, okay? Mr. Johnson. Lastly, I'm just going to have you look at the tip of my pen. As it comes towards your nose, try to refrain from moving your head, only move your eyes, okay? Go ahead. Perfect. And if you don't mind, can you just pull your eyelids down for me really quickly? Perfect. Okay. Upon this portion of the assessment, I've noted that my patient's conjunctiva is pink and moist. His sclera is noted to be white and his cornea is clear. I have also noted that my patient's eyes are perla, which just means that his pupils are equal, reactive to light, equal, round, reactive to light, and they do accommodate appropriately, and this is noted bilaterally in both eyes. All right, Mr. Johnson, I'm going to have you lift your head towards the sky for me. Okay, and if you don't mind, open your mouth and say ah. Very good. Upon this portion of the assessment, I noted that my patient's nares are patent, as well as the septum is not demonstrating any signs of deviation. I noted my patient's oral mucosa to be pink and moist, as well as no sores or lesions are noted within my patient's mouth, and the uvula is midline, as well as the dentition is noted to be intact. Okay. Now, Mr. Johnson, I'm just going to go ahead and assess your neck, okay? So that's going to entail a few things. So I'm going to assess your carotid pulse, as well as I'm going to assess the strength and range of motion of your head and neck and shoulders, okay?
Alright.
So first, what I'm going to have my patient do is I'm going to sit beside him, and I'm just going to palpate the carotid artery on both sides of the neck, one at a time. And then I will also auscultate the carotid artery in order to assess for any carotid bruit. All right, Mr. Johnson. Upon palpation, I noted my patient's carotid artery to be strong, as well as with a strength of +2. Now I'm just going to auscultate my patient's carotid artery in order to assess for carotid bruit. Mr. Johnson, when I complete this assessment, I'm going to have you breathe in each time I assess each side, and I'm just going to have you hold that breath for me so that we can hear this sound. A positive indication for a carotid bruit or any bruit would be noted as a swishing sound heard with the bell side of the stethoscope. Okay, Mr. Johnson, take a deep breath for me and hold it. All right, and I'm going to do the same thing on the opposite side. Okay, you can go ahead and release that breath. Upon auscultation of my patient's carotid artery, I did not note any carotid bruit. Okay. Now, Mr. Johnson, I'm just going to go ahead and assess the strength and the range of motion of your head, neck, and shoulders, okay? So we're going to do a few things. So I'm going to stand back up, and I'm going to have you place your cheek on the palms on the back side of my hand. As I apply pressure in the opposite direction, I want you to push against my hand by turning your head, okay? So go ahead and do that for me. Very good. I'm going to walk around and do the same thing on the opposite side. Go ahead and do the same thing for me. Very good. Okay, Mr. Johnson. And if you don't mind, I'm going to have you hyperextend your neck as well as flex your neck, okay? All that's going to entail is I'm going to have you look up towards the sky as high as possible, as well as looking down. Go ahead. Perfect. And if you don't mind, rotating your head from the left to the right. Okay. And I'm also going to assess your shoulders. So all I'm going to do is I'm going to do the same thing that we did for both cheeks. I'm going to apply both of my palms of my hands onto the tops of your shoulders, and I'm going to have you shrug your shoulders against the force of my hands, okay? So go ahead and shrug for me. Very good. Okay. Upon completion of this portion of the assessment, I've noted for my patient's range of motion in his neck, head, and shoulders to be adequate, as well as cranial nerve 11 is noted to be intact. Mr. Johnson, I'm going to do one more thing before we move on to the next portion. I'm going to actually have you lie on your back for me, so I'm going to have you lie in the supine position, and I'm going to have you lay against that pillow so that your neck is noted to be at a 45-degree angle. Go ahead and do that for me. Okay, and what we're doing during this portion of the assessment is I'm going to be assessing my patient for JVD, also known as jugular vein distension. This will be noted when my patient is at a 45-degree angle, and there are two ways we can assess it. I can have my patient lie in the supine position and elevate their head at a 45-degree angle, and I can also have my patient sit up from a laying down position in order to assess this at a 45-degree angle. And we would note a bulging on either side of the neck if this finding was present. So Mr. Johnson, I'm going to have you look up towards the sky for me. And I want you to slightly turn your head to the left and then turn your right for me. Go ahead. Okay, and to the opposite side. Very good. Okay, Mr. Johnson, you can go ahead and sit up. No jugular vein distension was noted within my patient. All right, Mr. Johnson, that's going to finish up our head. So next I'm going to move down to your thoracic, okay? All that's going to entail is a portion of your cardiovascular system as well as your respiratory system. So upon initial inspection of my patient, I would have my patient either lower their gown or remove their clothing items in order to assess the skin. For my patient, a normal finding would be noted to be the skin being pink as well as appropriate for ethnicity and uniform with the rest of the body. I would also note that there would be no bruising, scars, or lesions throughout my patient's thoracic region, and I would also note that my patient's respiratory effort is noted to be rhythmic, quiet, effortless, and no use of accessory muscles are being noted. All right, Mr. Johnson. So, and I would also note that the hair is dispersed evenly throughout this region as well. So Mr. Johnson, all I'm going to do is I'm going to assess two things on this one. I'm going to assess your heart sounds as well as your lung sounds, okay? So in order to assess my patient's heart sounds, I'm going to assess at 5 major points. Those 5 points are going to be the aortic, pulmonic, Erb's point, tricuspid, and mitral. I would note the aortic to be in the second intercostal space on the right sternal border. I would note for the pulmonic to be on the second intercostal space on the left sternal border. I would go down to the third intercostal space on the left sternal border, noting that as the Erb's point. Next, I would move to the fourth intercostal space on the left sternal border, noting that as the tricuspid. And lastly, I would go to the fifth intercostal space, left midclavicular line, noting that as the mitral point. The mitral point is also known as the apical pulse or the point of maximum impulse, and this is going to be auscultated for a full minute. So I'm going to go ahead and do that, and I'm going to use the diaphragm of my stethoscope for this portion. All right, Mr. Johnson. Now I'm going to auscultate the apical pulse for a full minute. Upon completion of auscultating my patient's heart sounds, I have noted for my patient's heart sounds to have regular S1 and S2 heart sounds, as well as no murmurs, clicks, or excess heart sounds being noted. I've also noted that upon assessment of my patient, upon auscultation of my patient's apical pulse, I have noted his pulse to be around 68 beats per minute. All right, Mr. Johnson, next I'm just going to listen to your lung sounds, and I'm going to assess all lobes. So all that is I'm just going to move through the anterior or the front side of you, as well as the posterior or the back side of you, okay? So I'm just going to have you turn slightly towards me. What I'm going to have you do, every time I move my stethoscope, I just want you to go ahead and take a deep breath for me. Just breathe in and breathe out for me. If you start to feel lightheaded or faint at any point, let me know and we can take a break, okay? And I'm going to use the diaphragm for this portion of the assessment as well. ahead and turn around for me and look at that wall. And we're gonna do the same thing, okay? On auscultation, I noted for my patient to have clear lung sounds bilaterally in all lobes. I would also note that when auscultating any lung sounds, I would not auscultate over bone. I would try to avoid bone and auscultate in between. All right, so Mr. Johnson, that's going to finish up our thoracic. So next I'm going to move on to your abdomen, okay? So I'm going to go ahead and during this portion of my assessment, I'll have my patient lie supine and I will be able to assess the abdomen at a better rate. During this portion, my patient also will be lifting his shirt just enough to where it is just below the breast line and right around the diaphragm line. So Mr. Johnson, if you don't mind, go ahead. Okay. So upon initial assessment of my patient, I note that his skin is going to be pink, appropriate for ethnicity, as well as uniform with the rest of his body. I've also noted no findings of abdominal distension, and his abdomen appears to be symmetrical. And we also are going to assess the abdomen in a specific order. So this order would include inspection, auscultation, and then palpation. The reason we do this is so that we do not disrupt any normal bowel sounds or bowel movements in order to be able to auscultate those intermittent gurgling sounds at a better chance. So Mr. Johnson, are you experiencing any pain at this point in time?
Right.
Okay. The reason we ask our patient if they're experiencing any pain is due to the fact of we want to work from the farthest point of that pain to the most prominent location of that pain in order to ensure that we're not disrupting anything or causing our patient to guard their abdomen, affecting our findings of our assessment. So now I'm going to go ahead and I'm going to auscultate my patient's abdomen, and we're going to work in the same order as the colon. So we're going to begin in our right lower quadrant, moving up to our right upper quadrant, moving over to our left upper quadrant, and then moving down to our left lower quadrant. And I'm going to auscultate during this portion of the exam with the diaphragm and my stethoscope as well. All right, Mr. Johnson. Okay, and a normal finding for auscultating the abdomen with the diaphragm and the stethoscope is going to be noted that we want to document a finding between 5 to 30 intermittent gurgling sounds per minute. Next, I'm also going to auscultate my patient's abdomen again in the same order. This time we're going to be auscultating for vascular sounds in order to note any bruit within the abdomen. And I'm also going to be using the bell side of my stethoscope for this portion. Upon auscultation, I did not note any bruit within my patient's abdomen. Now what I'm going to do is I'm going to palpate my patient's abdomen, and since my patient stated that he is not experiencing any pain at this time, we can go ahead and complete this portion of the assessment in the same order as auscultation. So I'm just going to go ahead and I'm going to auscultate. Tell me if you feel any pain or tenderness anywhere, okay? Excuse me, palpate, I'm sorry. Any pain or tenderness? All right. So upon palpation of my patient's abdomen, I've also noted that there is no pain or tenderness, as well as no abnormal findings of any lumps within my patient's abdomen. And that is going to wrap up the portion of my abdomen. Mr. Johnson, if you don't mind sitting down for me. Lastly, I'm going to assess my patient's extremities. This is just going to include the upper and lower extremities, or the arms and the legs. So Mr. Johnson, what I'm going to do for this portion is I'm going to assess a few pulses, as well as I'm going to be assessing your range of motion within each of the extremities, okay? So I'm actually going to have you lay back down for this portion of the assessment, just so that we can palpate these pulses, okay? I'm also going to note for this portion of the assessment that I'm going to be palpating these pulses bilaterally in order to ensure that they are equal bilaterally and there are no abnormal findings noted during the palpation. So first, I'm going to go ahead and I'm going to begin with my patient's brachial pulse, which is going to be noted in the inner upper arm, right above the antecubital portion of the forearm, of the upper arm, excuse me. Next, I'm going to auscultate my patient's radial artery. We're going to be moving to femoral. Femoral is going to be noted in the inner groin. And then lastly, I will be also palpating the dorsalis pedis, or the pedal pulse, as well as the posterior tibial pulse. I'm going to demonstrate where these pulses are located to ensure that there is clear instruction. So Mr. Johnson, I'm going to have you lift your left leg for me. So the dorsalis pedis pulse is going to be noted within the first and second toe between the metatarsals, and it will be noted at the top of the foot, on the top of the foot, I'm sorry. And your posterior tibial pulse will be noted about the midpoint between the heel portion as well as the inner ankle bone, and it's going to be around right here, and you should be able to palpate that pulse as well, so I'm going to go ahead and assess those pulses. All right, Mr. Johnson, if you want to sit up, you can for me. During completion of palpating all of my patient's pulses, I've noted these pulses to be equal bilaterally, as well as with a strength of +2 with no abnormal findings noted. Mr. Johnson, all I'm going to do now is I'm going to be assessing the range of motion of your extremities, okay? So if you don't mind, I'm going to have you stand up for me, and we're going to do a few things, okay? So if you want to step over just a little bit to the right for me. So first, what I'm going to have you do is I'm going to have you abduct your arms, which means bring them out for me. Sorry, go ahead. Okay, and then bring them in for me or adduct them. Next, I'm going to have you flex your arms for me. Extend your arms. And then we're going to do what's called circumduction. I want you to abduct your arms one more time for me and rotate them in a circular motion. Very good. Okay, now I'm just going to do the same thing for your lower extremities, okay? So we're just going to be checking your hips and your knees, everything of that sort, okay? So I'm just going to have you, I'm going to turn towards you, that way you're able to see my demonstrations. So first I'm going to have you flex your hip for me, so bring your foot forward. And then if you don't mind stepping forward for me so that we can go ahead and, there we go, okay? Now I'm just going to have you extend your leg back for me. And then we're going to get it back as far as we can to hyperextend it. Perfect. And I'm also going to have you do the same thing with your foot. So I want you to take your foot, go ahead and flex your hip for me again, and go ahead and extend your, very good, extend your foot towards the ground, as well as dorsiflex your foot towards the ceiling. Okay, very good. You can go ahead and put that leg down. We're going to do the same thing on the opposite side, okay? I'm going to have you flex that hip, extend our leg, hyperextend it. Very good. And then I want you to abduct your leg out. Bring it back in, adduct. Very good. And then we're going to flex our foot and dorsiflex our, extend our foot and then dorsiflex our foot. Very good. Okay, Mr. Johnson, if you want to go ahead and have a seat in this chair for me, we'll continue the assessment over here. Upon assessment of my patient's range of motion within all extremities, I have noted that my patient's extremities do have full range of motion and no limitations or deficits were noted. I've also noted that upon initial inspection of my patient's extremities, that his skin is pink and uniform with the rest of his body, as well as appropriate for ethnicity. I have noted that hair is evenly dispersed throughout all extremities, as well as my patient does not seem to be demonstrating any signs of edema, as well as no bruises, scars, lesions, or any other abnormal findings throughout my patient. My patient's skin is also noted to be warm to the touch in all areas. Okay. So now what I'm going to do is I'm going to be assessing my patient's patellar reflex, which just means that I'm going to be checking the reflex of his deep tendon. And this is going to be found right here in this tendon below the kneecap. So in order to assess this reflex, I would note that I would need a reflex hammer or any approved tool to aid in completing this assessment. For this portion of the assessment, I'll be using my stethoscope. So, Mr. Johnson, all I'm going to do is I'm going to be assessing your reflex to the reflex instrument. In order to do this, I would note that below my patient's kneecap is the deep tendon, and I would also note that this is where I'm going to be slightly applying a force in order to assess my patient's reflex when doing so. So I'm going to go ahead and do that now. So just go ahead and relax for me, Mr. Johnson. Just look forward for me, okay? I'm going to go ahead and do the same thing on the opposite side. Okay, and I would note that during this assessment, you would want your patient to be at a heightened level so that they are able to sit at the edge of the seat, allowing their legs to dangle and relax entirely with those muscles in the lower extremities. Another thing that we also would assess would be the clonus reflex. This is going to be typically done within pregnant females, and I will demonstrate on my patient, although there will not be a positive finding within my patient. In order to assess the clonus reflex, what we're going to do is I'm going to come over here and I will demonstrate with one leg. I'm going to support my patient's calf, and then simultaneously, I would have my patient barefoot. Simultaneously, I would place the palm of my hand onto the plantar portion of the foot, and I'm going to dorsiflex the foot at a quick rate in order to assess a beating or a thumping motion of my patient's ankle, and this would be indicated as a positive result. Typically, this finding is going to be noted in a female patient that is experiencing something that is known as a disorder of a preeclamptic pregnancy. So I'm going to go ahead and demonstrate how we would do this assessment. While supporting the calf, I'm going to dorsiflex my patient's foot, and my patient's going to demonstrate that beating motion in order to, very good. So that ankle right here is going to start beating or bouncing in order to demonstrate a positive finding. Like I said, this would be in a woman with a preeclamptic pregnancy. And this is going to be noted as a positive finding when 3 or more beats are noted upon dorsiflexion. All right, Mr. Johnson, do you have any questions for me?
No, ma'am.
You still doing okay?
Yes, ma'am.
Okay. All right, are you experiencing any new pain or anything?
No, ma'am.
Perfect. Let me go ahead and put your shoe back on for you. Okay, Mr. Johnson, if you want to go ahead and get back in the bed for me, go ahead and lay down. Okay. Upon completing my assessment, I would note that I would place my patient in a position of comfort as long as it is safe for my patient, as well as lowering and locking my bed. I would place my side rails up ×2, as well as leaving my call light within reach for my patient. Mr. Johnson, I'm going to be back within an hour to check on you again and reassess your vital signs. If you need anything in the meantime, please refrain from standing up and use your call light in order to contact me so that I can come check on you safely, okay?
Ma'am.
All right. At this time, I'm going to gather my supplies. I'm going to perform hand hygiene, ensure that I do maintain HIPAA at all times, and I'm going to go document my findings, and that completes my head-to-toe assessment.